And we're going to work up into the muscles here, because all those muscles that extend her wrist and put her in that position attach up through this area. More so the muscle bellies are up here.
Hey guys, it's Jayla, your Kalkstein Chiropractic CA. Today I have Dr. Angie.
Hi.
Dr. Angie is one of our new doctors. She's going to be jumping on the team and she's going to be jumping in and help us out.
All right, so we have Jayla here, and she was having some wrist irritation after working really tightly fixing links in a watch band. So this position her wrist for a long period, and she's having some irritation and inflammation on this side, so we're going to go ahead and use the laser to treat that.
First and foremost, the glasses, of
course. Get the fancy shades.
Do I look cool?
Right.
You always look cool.
Thank
So
you so much.
I'm probably going to do 15. You want to do just for example purposes?
Yeah, that's cool.
Cool.
Technical difficulties. Yeah. And then just...
I was going to say, just again.
It's just so sensitive sometimes.
It wants to be touchy.
Yes.
Oh,
too early.
That time I waited.
Yeah, I push it again.
What's wrong with Jeopardy music?
Doom, doom.
Yeah, right? Just like fast forward through this part.
Sensitive machine here. There we go.
There you go. Now it's working.
Yes.
Yeah, I was going to say bring the pillow a little bit more. Yeah.
Okay.
So you haven't tried this head yet, Jayla?
I have. I use this one on usually like TMJ or stuff like that, like on like the face and stuff. But I don't know why when Dr. Angie put it together, it looks so different. And I don't know what that was. I'm like, I've seen this before though, so I'm not sure what's happening. But yeah.
Have you personally tried that one?
I have not used this on myself. I usually use the rolly one.
The big ball one.
Yes.
Yeah, some other different lasers, they only have like one of the other two heads.
Really?
That's it. Yeah, I had never seen the one with the ball that rolled.
Oh, nice.
So I was like, oh. And the other thing was you weren't supposed to have direct contact with the skin for one of them.
Interesting.
Very interesting one. So there are a bunch of different type of lasers, but they weren't of this quality. I think that was why.
Yeah. The warmth feels amazing.
Good. And we're going to work up into the muscles here, because all those muscles that extend her wrist and put her in that position attach up through this area. More so the muscle bellies are up here than they are down here at the wrist, but still where you get the tension and where we're having our pain. Let me know if it becomes too warm.
Yes, we'll do. Beautiful. Now maybe after this I can put my watch back on my left wrist because I'm looking for the time and it's on this side.
I've done that so many times. All right.
Yes, thank you.
You are welcome.
Woohoo. Okay.
We are done.
We are done.
I'll switch back the head of it so that way you guys are back to your normal.
So we're not confused when we see it. All right.
Oh, stay.
Yeah. Okay, I know what we do now that's different. We take off this whole thing.
Ah.
That's what I'm like, it looks so different. So usually we take off the whole thing.
That makes sense too.
But I love how that fit. I didn't know that was gonna do that.
I wasn't sure that, I mean, I didn't realize that this whole head did come off, so we learned something new.
We both learned something. We love that. All right. thank you guys for watching, and stay tuned for more Dr. Angie videos.
Yeah.
This will be fun. See ya.
Bye.